Youth webinar for May. Thanks everybody for joining us. I'd just like to acknowledge the support of all of our funders over the years and all of the research organisations and universities who partner with the Wellbeing Health and Youth Centre of Research Excellence in Adolescent Health. And I'd like to acknowledge the traditional owners of country throughout Australia and recognise their continuing connection to land, waters and culture. And I pay my respects on behalf of everybody to elders past, present and emerging. And I'm joining everybody from Gadigal land. I'd just like to remind everybody about our Wellbeing Health and Youth Community of Practice. It's a, if you can access the website, you'll find it there, and you'll see where all of our resources. Please check in every so often to see if there are any new resources that are applicable to you and your work. And again, just to give everybody a bit of an idea about how this all works, you've got a chat function on the right, and you can put in your questions, and at the end you can have a conversation with other audience members as you like, but at the end we will answer your questions. We'll go through and we've got Sharon Medlow here who's helping us. We'll go through and identify all the questions, and we'll have time to answer them. So I'd like to welcome Dr. Daniel Waller. Dan has a PhD in psychology and a background in health behaviour research. He's worked in several research and teaching roles in university, hospital and not-for-profit organisations. And Dan's research focuses on improving the lives of young people with a particular focus on health and education. Dan specialises in policy analysis, qualitative research, co-design, implementation science, evaluation research, and intervention mapping for health and education programs. Amazing, Dan. I'm looking forward to hearing your presentation. You do incredible work. So
thank you.
Welcome, Dan.
Thank you, and thanks, Rachel, for such a lovely introduction. It looks like we've got a great turnout today, so thank you everyone for your time. It's really nice to have the opportunity to present. And so today I'm going to be talking a little bit about some of the research that we've done through the Centre of Research Excellence around youth health policy. Before I jump in, I just want to again acknowledge country. I'm joining here today on Darug land. I'm out at Westmead, and this artwork is actually from a PhD student at the centre that I'm working at, the Transforming Education and Child Health Research Centre at Western Sydney University. And the title of that artwork is Changing Through Voices, painted by Bradley Burns. And so I thought it was a nice image to kind of talk about, because this is really one of the central tenets of the Wellbeing Health and Youth Centre of Research Excellence, is really trying to promote that importance of the experiences and voice of young people. So today I'm going to whip through a bit of work that we've been doing. I'm hoping I can stick to time. But firstly, I want to talk a little bit about the current state of Australian youth health policies and what the scope is there. Then move on to some of the current issues around policy development and implementation. And then have a bit of a chat about what we can do. So looking at implementation strategies, youth involvement in policy, and health policy development approaches. So hoping I can get through all of that. So firstly, why does youth health matter? So a lot of us on the phone call are already fairly well versed in the issues surrounding youth health, but we know it's adolescence and young adulthood is a really critical stage for health and wellbeing. There's a lot of changes socially and behaviourally at this time. People are getting a lot more responsibility and independence. And it's a time when there's a lot of health behaviours and service engagement patterns start to kind of really emerge. So how well a young person engages with health behaviours and the services at this stage can be quite predictive of long-term engagement as well. It's also a period where a number of new health risks emerge, and some of those are very behaviourally based. So, things like suicidality, drug use, alcohol use, risky behaviours, and then also particular conditions that might appear at this time as well. And there's a lot of evidence to show that effective care, prevention and intervention during this time can have really strong lifelong impacts for the young person. So then with that in mind, why does youth health policy matter? Well, policy shapes how systems work, so particularly the health system, and it can make an impact on health service delivery and can reduce entrenched inequities. We know that youth health is underrepresented in healthcare expenditure, research and practice innovations. And so we can use policy to try and prioritise the issues and funding as well that's attached. It's a really good time to look at policy in the youth health space. A lot of nations are at really varying stages of policy development. So it's nice to kind of have a look at what Australia's doing and where we're heading. So what is the current state? So in 2019, we engaged in a scoping review of current policies to look at and trying to determine the extent, range and nature of Australian policy specific to the health and wellbeing of young people. So we were really interested in policies that were looking at the general population of young people and also policies that were looking at general health and wellbeing. So not a specific group of young people or not a specific health condition like diabetes or mental health or some kind of other condition. So we conducted a scoping review and we really focused the scope around prospective policies, plans, strategies, blueprints or frameworks, which were coming from Australian federal, state or territory government departments and looking at anything published between 2008 and 2019. And for us, our definition of youth we used was from anywhere from between 8 and 25 years, and we included expired or rescinded publications because they still impact the policy landscape that we're working in. So the real research questions were, what are the coverage of these policies and what are the key themes of those policies as well? So we engaged in a scoping review, which is an alternative to a systematic review. It's great for exploratory research with broad topic areas, and you can include non-research articles, so grey literature and policy documents. And that allows for qualitative analysis of those documents as well, and it's a really increasingly popular approach to literature reviews. So we conducted thematic analysis in NVivo 12, identifying key themes using inductive coding so that we didn't have a preordained structure that we were doing, we're just letting the data speak for itself, and we organised those into semantic themes. So it's very hard to see the images there, but we basically started with about 790 original websites were identified through government directories and pared those down to relevant websites and looked at 126 of those. We then went through a process of searching those websites, and we also searched for peak body and policy websites, which are the Australian Policy Observatory, the Australian Adolescent Association for Adolescent Health, the Student Wellbeing Hub and youthpolicy.org. So that was our way of trying to find these documents. And what we found was 12 policies relevant to the general health and wellbeing of young people that were available at the time. Again, this slide might be a little bit difficult for people to see, but what we could see is that there was a fairly good spread across the states in terms of policies that had been developed. And we did have a couple of national policies as well. And if you look at it, you can see that there's quite a lot of policy development around this kind of 2015 to 2018-19 period. So it does seem to be an increasing area of interest. What we did see was an increasing area of interest and also that there was a bit of variance in the timeline. So some of the policies were around 3 years, so looking very short term, and some of them around 10 years, so a bit of a broader term approach to policy development in that space. And again, there was variance in the age groups covered. Some covered all the way from 0 to 25 years, some covered 10 to 25, or some actually included other kind of groups as well. So it may be like maternal health and youth health or pediatric groups. But we did include those because they did have mention of adolescent health and had a focus on that kind of youth segment. So from that, we identified that there was 3 kind of key things that were coming out of the analysis of the policy documents. One was around defining health, and we could see that there is this move towards an increasing strength-based approach and this focus on life course approaches. So understanding that adolescence is a period of time where health behaviours are occurring, that they can have lasting impacts for the young person. And the more newer policies really have this strength-based approach in trying to build resilience for young people. In terms of policy consultation, all of the policy documents were developed in consultation with clinicians or researchers or some kind of experts, considered experts. But unfortunately, only 6 of the 12 consulted with young people, which is a bit of a concern. The more newer policies were more likely to include young people in their development. So the research and evidence base for the majority of these were quite strong. A lot of them used epidemiological data to build their policy, or literature reviews of the research that are out there. And then a lot of them actually had engaged a specific research project to identify information to build that policy as well. So it was quite a good evidence base that we're working off. And then there was obviously links to other policies that are relevant. So that might be national policies or other, area-specific policies that may be relevant. So the second theme looked at youth health challenges, so identification of health concerns in at-risk populations, and then some issues around the health system. And there was quite a bit of talk about the socio-ecological determinants of health within a number of the policies, and some discussion of intersectionality as well. So a lot of the youth health challenges are quite well understood and quite well identified within the policies. And then thirdly, there was this theme around policy goals. So by looking at all of these policies, they did become this kind of very clear thematic groups of different goals that are available within policy. So the first was supporting public health, looking at things like prevention, intervention, and management of conditions. And that had a really strong focus on education and public education. So that may be through advertising or through schools. The other theme looked at promoting equity, so increasing access, affordability, and availability of services for young people, really focusing on health literacy for at-risk populations, and then some health workforce development, particularly for Indigenous health workers to support Indigenous communities. And yeah, this idea of socio-ecological determinants, knowing that there are things out there that are affecting the health of young people that are not necessarily just sitting within the health department kind of scope of practice. And then finally, this theme around improving the health service, and that was really looking at service quality and things like youth-friendly health services, how health services collaborate and work together, and the integration across different systems, whether they're able to share information very easily, and how that kind of process and navigation works for the young person, whether they can move from service to service across the health system in an easy and easy to understand manner. There was a lot of talk about technology and in terms of different approaches that might be available, some kind of focusing on regional and rural youth, but then also just utilising technology that young people are actually utilising as well. So focusing on things like SMS messaging rather than sending an email or sending a letter. And then again, this kind of focus on health workforce and developing a workforce who has a real confidence in working with young people and the ability to kind of understand some of the issues affecting them. So the key learnings from the scoping review really showed that the development of policy in this space really does seem to be improving. There's an increased interest and increased development of policies. We're moving away from deficit models towards a strength-based approach, and there is a real recognition of socio-ecological factors. However, there's not necessarily action on those. There's really strong evidence base for the development of the policies and growing youth participation, which looks to be a promising thing. There's really 3 clear goals: supporting public health, promoting equity, and improving the health system, which seem to be fairly universal across the policies and seem to be a good kind of framework for where we're heading. However, the implementation process for the policy, so the development seems to be fairly clear, but the policy implementation processes aren't really discussed in the policy documents, which is fairly understandable, but it does mean that we really don't know what kind of methods we're going to be using to tackle these socio-ecological determinants of health, what the budget or governance structures are going to look like, what the planning, monitoring, evaluation systems are like, how it's going to be implemented, and what the kind of success measures are that we could use to determine whether this policy is actually effective and is having a great impact for youth health. Since we've conducted the policy scoping, that it's important to note that there are new policy developments. So Queensland have released a youth strategy around youth health, and then the federal government has the Australian Youth Policy Framework, which is trying to look at how some of the kind of broader interdepartmental issues may kind of come together to affect youth health. So it's going to be interesting to see how that plays out with some of the policies that are already in place. With that all in mind, what are the current issues around policy implementation and development? So whilst it's really useful to kind of look at what is out there in terms of scoping the available policies, it's really difficult to identify how the policies are implemented from that document analysis. And it's hard to identify the context and mechanisms that have impacted both the development of that policy and the implementation of that policy as well. And so that's why we conducted some further qualitative research. So the aim of that research was to identify general themes relevant to the development and implementation of policy from the perspective of policy workers. So we're really interested in the barriers and facilitators that impact both the development and the implementation of Australian youth health policies. So we conducted qualitative research using semi-structured interviews via Zoom, and we had thematic analysis using deductive frameworks and inductive coding. So the deductive framework utilised was the Consolidated Framework for Implementation Research, which comes from the implementation science field, which is quite useful to understand how things get implemented within systems. We included policy workers with experience in the development and implementation of youth health policies. And we utilised a convenient sampling and snowball recruitment approach. So we looked for the policy authors if they were listed within the policy documents. We looked through federal, state and territory health departments and agencies to try and see if there were people that we could find there. We actually relied quite a lot on LinkedIn to identify people because they're not necessarily put onto a department website. And then we utilised the networks that we already had as well to kind of try and identify people who might be able to participate. And then just snowballing from there, being able to kind of have someone who's already participating, identify other people who might be worth talking to. So a lot of people may not be necessarily across the Consolidated Framework for Implementation Research or implementation science more generally, but basically it's arguing that implementation can be affected by a number of factors, barriers or facilitators at different settings or contexts and levels of system settings. So within the outer setting, it's trying to understand patient needs and resources. What are the needs of the young person? It can be affected by cosmopolitanism, which is kind of how different departments or agencies or organisations work in relationship with others. And then things like external policies and incentives. So what is already out there in the policy landscape that may have an impact on the development or the implementation of a particular policy. Within the inner setting, there's things like networks and communications. How do people kind of discuss and talk and work with each other? Specific cultures and climates for implementation and the readiness of that. And those things can include particular resources available. And then there's things like around the individual characteristics of the individual people may be potentially developing that policy or responsible for the implementation. So that might be around the knowledge and beliefs of the policy, whether they think it has legs, whether they think it's going to work, and how that impacts the work that they may do that has some kind of impact on that. Then there's also the processes of implementation. And so that could be the implementation in terms of the development of that policy, or also the actual implementation of the goals and specific objectives of that policy. So how was it planned? Were people engaged? And how was that kind of execution process rolled out? And then there's the actual characteristics of the policy itself. So is it fit for purpose? Do people think it's a good policy? Is it adaptable to different climates? Those kind of things. So a lot there, but it's a very good model to be able to kind of look at implementation of these things. So we're able to recruit 19 policy people. And we had a really good spread across states and also the federal government. So it was nice to be able to kind of capture a range of perspectives from a range of different health departments to see what the kind of issues were. And so when we looked at the inner setting, there's a number of kind of these factors from the implementation research framework that were relative and related. And one of those was relative priority. And so what we found is that youth health often receives lower priority within health departments and within the health system generally. And we found that there was a bit of cannibalization of attention from other related populations. And we saw that when we looked at the scoping review as well, where often the policy was developed for pediatric groups and adolescent and young adults, or maybe even maternal health and children and adolescents and young adults. And then also other policies in terms of, say, mental health, where there was a bit more funding going towards that kind of approach. In terms of tension for change, it's looking at whether there is a kind of a bit of a movement towards some kind of change within a system. And so what we did see there is a groundswell in external attention, which really helped policymakers kind of get youth health on the radar. So things like the Lancet Commission into Adolescent Health, the World Health Organization guidelines, a number of advocacy groups, Wellbeing Health and Youth, CRE being one of those, and a number of academics working in this space. So those kind of things can really help persuade others to kind of develop a policy, or then also argue for its implementation as well. Within the inner setting, we found that a lot of policy development in the youth health space, and particularly implementation as well, it's working in a context of very limited resources, so limited staff and limited development budget. So there's not necessarily very much budget to develop a policy within the youth health space, and then also limited budgets to actually implement that policy once it has been developed. So a number of the policies were developed and had some funding to do that, but then they didn't actually have any money to roll that policy out, and it just becomes, in a way, a guidelines for the rest of the health service to pick up. There was this idea that mental health policy seemed to be better funded both for development and implementation as well. In terms of compatibility, there was this issue around the variability and the degree of control over local implementation. So again, whilst this policy can kind of suggest what needs to occur within the health system, it doesn't necessarily have the power to mandate action. And there was this idea around a lack of power and authority to really mandate change. And then when looking at the outer setting, it was fairly clear that the needs of patients, in this case, young people, was very well understood by the participants in this study. So the people developing their policies and implementing those policies as well really do have a great understanding of the key issues that are affecting young people for their health and well-being. But they often report that that was less well understood by governments, health departments, and the broader health system. So there still seems to be this kind of thing about an understanding of the uniqueness and the unique needs of young people when it comes to wellbeing and health. And then again, around the evidence strength and quality, which I guess I kind of touched on in that scoping review, is that there is a really strong evidence base for policy development. So there's a lot of research to show what the needs are for young people. However, there's limited implementation science utilization. So in terms of implementing that policy, there's not very much research, and there's not very much research to identify particular programs or policy actions that may be the best bang for buck in terms of what you could do to address a particular need. So there does seem to be a bit of a need for more research or some kind of way of gathering that evidence so that policy makers can really identify the best programs to help young people achieve health and wellbeing. Finally, there's a mixed approach to publication. A lot of the policies came with research attached to it, so they had some funding to develop research, which then fed into the policy development. And some of the participants then went on to publish that in formal academic publications, whereas others, it turned into more of an internal document that was grey literature and pretty difficult to find or identify as an outsider. So that has some implications for the broader academic field, and has some implications for replication of work and things like that. And finally, there's this issue around cosmopolitanism. And so there's these really mixed reports on external collaborations. So in this kind of issue around tackling social determinants of health from within the department. So there's this kind of issue around being able to have limited authority to direct external services or departments. So, for example, working with the health and an education department or health and justice, there's these kind of cracks and silos between these departments, which make it very difficult. And because there's a clear lines of jurisdiction within the departments and what their scope of work is, but a lot of these social determinants are sitting outside of those clear silos. And so there is this real tension on what can be done from a specific department on these issues that are having impacts on multiple ranges of outcomes, which could be health, education, justice, all these kind of things. However, there were mixed feelings on whole of government approaches. Some said we need a whole of government approach, otherwise we're not ever going to be able to tackle the social determinants of health. And then there are others who had misgivings and some, I guess, less positive experiences in working across departments. So it's clearly an issue that needs to be addressed in the future. In terms of engagement, there was broad engagement with youth from the participants. However, they did identify that there were still concerns around tokenism and remuneration. So a lot of the young people involved were not remunerated for their time. And then often there was not necessarily a fantastic feedback loop to the young people to say, this is what we heard and this is what we've done. And then also there was these concerns around marginalisation, and that the people who really need the most help are probably less likely to have their voice heard because they just don't have the time to kind of engage in these policy development consultations. They've got other fish to fry. And then finally, this idea around monitoring and evaluation. There was this discussion that there's a lack of implementation and monitoring of the policies, and then there's limited success or measures or targets. Some of the policies had quite advanced monitoring and measurement frameworks, whereas some of the others had very minimal. So there is a lot of variance in that. And I guess that's something to kind of think about in the future as well. So in terms of this research, there are a number of limitations. There's a recruitment bias. So the policy workers were primarily those involved in development of policy rather than those implementing. And they were all from health department funded employees. So you're getting a very narrow perspective of policy development and implementation from a specific cohort, which can be a strength and can be a weakness as well. There is the risk of reporting bias. These are people working in governments and policy. They have reputations, so there is potential for some reporting bias. And we weren't able to do any kind of international comparisons as yet, but I think that could be an interesting thing to look at. And then obviously these things take time. Qualitative research is a time-consuming process. So it's not necessarily easy to kind of replicate over and over again. So concluding from these last two studies, we know that youth health policy development has increased. They're very well researched, particularly for development at least, and a lot of work goes into their development. Youth engagement has increased also. However, there are still concerns around tokenism and what that means. What is co-design? What is consultation? And then there's this issue around the lack of clout in the form of funding, resources, and political power to dictate or enact recommended policy action. So a real implementation challenge. There's difficulty working across departments, jurisdictions, and silos. Limited monitoring and evaluation, all that is variable. Limited ability to comprehensively respond to the social determinants of health. And we really need a pretty strong political will, implementation plans, and monitoring mechanisms required with policy going forward. So with that all in mind, what can we do? So I thought I talked about a few different things. One of the things that I think is really useful about using implementation science approaches to policy is that there is some research that looks at these kind of different barriers and facilitators to interventions and implementation. and then they can be matched up into solutions and in different ways that have varying effectiveness for those challenges. And so I listed a publication there that kind of talks about some of this, and it's still in the very early stages, but it does give us some kind of idea of where we can go once we have identified particular challenges. So when we're thinking about the tension for change and whether there's enough of a build up for us to really kind of steam forward with an approach to youth health, one of the things that we can try and do is identify and prepare champions. So that could be someone within a particular department, and inform local opinion leaders when looking at patient needs, using patient consumer feedback, involving patients and consumers in the development or the implementation, and then preparing them to be active participants. So having that really kind of youth-focused approach. In terms of cosmopolitanism, you can build a coalition, so getting a kind of strong group of people all interested in the same thing, which I think Y has done very well. And then promoting that kind of network weaving, so looking at ways to join potentially state departments and federal departments and people who are kind of working within this space to know who each other are and to be able to discuss the kind of issues that are affecting them. And then also developing academic partnerships. In terms of available resources, always the funding issue, trying to lobby for funding. But then in these kind of resource constrained areas, developing resource sharing, so having some kind of resources that can be shared across departments or across states, and capturing that kind of shared local knowledge as well, and being able to kind of help each other to address the kind of issues that we're all kind of facing. And then finally, evaluation and monitoring, so developing tools for quality monitoring, auditing, and providing feedback. And so these things are nothing new, and a lot of this is already happening in the policy space, and it's a lot of it is some of the things that the Y Commission and the YCRE are really trying to champion as well. So not groundbreaking solutions, but at least it kind of gives us an area to focus in on and say, well, this is what we're trying to change, and this is how we're going to do it. So with that in mind, I thought some good resources for youth voice and co-design that can be utilised for policymakers. There's the Y Youth Engagement Framework and Guidebook, which would be available on the Y website. And then there's the Young and Resilient Research Centre Co-Research Toolbox, which again can be kind of proxied for policy development as well. The Young and Resilient Research Centre has just a huge amount of tools and resources available, and I would encourage everybody to have a look at that. There's some fantastic stuff that they're doing, which is really relevant to youth health. Okay, and then finally, I thought I would finish with a bit of a case study on policy development in action. And this is working from some stuff that's a little bit old now, but it does have a bit of a how to involve young people in the development of policy. So the Access 3 studies were engaged, the New South Wales Health engaged some of our researchers from the Y Commission, YCRE, through competitive tender to conduct the Access 3 studies. And there was a number of studies which really focused on youth health access and navigation in the New South Wales health system. So that's included a youth survey with about 1,500 young people in it, a longitudinal qualitative study of young people's journeys through the health system, some health professional interviews, and then a knowledge translation activity, which I think I'll present today. And so the knowledge translation activity consisted of a one-day facilitated forum. And so what had happened is the larger studies had already been conducted. And then from that, there was a synthesis of that evidence from the research team. And then utilizing that, there was the idea that they were going to do a facilitated forum. And so they were pulling all this information together for the participants, and then having this knowledge translation activity. So the day ran, there was forum presentations by a number of people, including young people and researchers and policy people. And then the participants were split up into small group discussions. So I think there was about 64 people involved, and there was 8 themes and 8 tables. After the small group discussions, there was a workshop evaluation to see what people thought of the day. And then later on, there was a synthesis and submission of those policy recommendations that came out of the day. So the table on the right shows the themes that had emerged from the Access 3 studies. And they were the themes that were given to the forum participants to kind of consider and then discuss on the day. So for each of those small group discussions, the workshops tables were given a number of questions. So how does the group understand and support the theme? Which groups or locations or health settings is the theme particularly relevant for? Who would need to be involved in implementation? How can the theme be implemented? And what difference would it make? And what would support implementation? So some pretty broad questions. And there we go, there's 64 participants within the group. So engaging 8 young people, a number of New South Wales Health Services people, academics, policy people, general practitioners, and 1 mental health clinician as well. So from the workshops, there was 25 individual policy recommendations that came out of those, which were developed across the tables. And they fell into 6 broad themes of technology solutions, integrated care and investment, Medicare structures, workforce, youth participation, and quality systems. So with those policy recommendations, there was a voting process where people were able to vote on what they thought were the most important policy recommendations. And all of that information was then delivered to the Access 3 research team to try and synthesize the information and try and come up with some policy recommendations that were then presented to the New South Wales Health Department and the Ministry. So the evaluation of the day in the forum, 70% of the participants who were there completed an evaluation form, and 93% of those who did complete that evaluation thought that the workshop meaningfully contributed to the knowledge translation, and 88% felt they were able to contribute to the small group discussions. This slide's fairly difficult for people to read, but basically what we then did was a post hoc analysis of the recommendations that were coming out of that workshop forum, and then mapping that onto the New South Wales Youth Health Framework, which was the policy that was developed from these access studies. So this is just a few examples of how we think that the recommendations from the policy forum were then transitioned into a specific section of that youth health policy. So it's interesting to kind of look at that and see where the translations kind of occurred. So with all this in mind, so what? I thought that the access study is a good kind of identification of how we can move from research and knowledge translation into policy development, and then also include the voice of young people. Admittedly, it's a small voice at the policy development workshop, but there was a large focus on the inclusion of marginalised young people, particularly in the research. So we were able to kind of pull that youth voice into that development of that policy. And again, what we're seeing is that overall youth health policy is heading in the right directions. We do need to try and figure out this approach to youth participation and what that means. When should we consult? When should we co-design? And how do we include young people in the implementation of the policy, not just necessarily the development of that policy? As always, anywhere, funding, resources, those things are very important. And so is the knowledge translation of this research. We need to have evaluation and monitoring of the policies, and research partnerships can be quite useful for developing that. And then I guess I thought I should also touch on the fact that health service review is quite important. In 2019, the HEM review was established, which is a review of health services for children, young people and families within the New South Wales health system. And if you read that review, you can see that a lot of the recommendations are really echoing what we have here and goes into a lot more detail as well. It was a very extensive review. And so I think sometimes we need to just look at what the research is already saying, or what the reviews are already saying, and saying, well, how can we then implement this into a system? And I think that's where things like implementation science approaches can actually be really useful, because it starts to kind of move us away from just identifying this issue or the problems and then going, okay, well, what are we going to do? From this work, we've got 3 open access publications, which are all available. So you can go online, they're free to access. And in terms of that kind of like building relationships between states, organizations, workers, all these kind of things, we do have a AAAH policy workshop on the 19th of June, which is open to policymakers specifically. And we're hoping that that kind of becomes one of those steps within the implementation trail, where we start to kind of really have the ability to share these resources, understand issues across the board, and develop those kinds of relationships as well. So I think there's some promising work ahead. I think I'm going to cut there. I just would like to acknowledge that this work was funded through the Wellbeing Health and Youth Centre for Research Excellence from the NHMRC, and also acknowledge and celebrate the life and work of Professor Fiona Brooks, who was my supervisor at UTS when I was doing this work. And she was a lovely person and really helped me with my postdoctoral journey. So, and she just really cared a lot about continuing education and wellbeing of young people. So I just wanted to acknowledge her work. And then again, acknowledging the research participants and the funding from the NHMRC. And I think I can finish up there.
Now I am here, even though I'm not on camera for some reason. Not sure why. But thank you very much, Dan. That was a fabulous presentation. I knew that it was going to be amazing, and also nice to reflect on the life of Fiona at the end there. And I just wanted to say, I don't think I introduced myself, but I'm Rachel Skinner and Deputy Director of Wellbeing Health and Youth. And I'm a professor at Sydney Uni and also a clinical stream director for priority populations at the Sydney Children's Hospitals Network. Now we have some questions, so I'm going to bring them up for you. So first off, we have hang on, actually, yeah, so we'll start with Helen. I think there was another question actually. So Helen's a comment really just about tokenism, and that she noted that in the National Obesity Strategy published in 2022, they talked about the importance of adolescent consultation, but funnily enough, though, they didn't actually consult with adolescents, they consulted with the young adults. So, and I mean, I've certainly experienced this as well, that, you know, in development of policies around a health issue, that where young people are identified as a priority area, that the absence of the youth voice in the consultation process. So that's happened in my experience around various youth health policies. So I think there are lots of challenges in bringing young people voices to bear on things just around the recruitment. And we do have another question about this. There's also ethics challenges as well. So we've got another question down here from Louise. Recruitment of young people. Can you clarify age of young people? Curious to know processes for recruiting if school age. So I think, and were you hoping for more than 8 young people in your study? So I suppose just a general question about youth participation in the development of youth health policies and then your experience.
Yeah, I guess there's a few things. So in terms of age, there's definitely an ethics issue there. So I guess the definition, even our definitions of youth are different across different jurisdictions, but anyone from 8 to 25 would probably sit within that youth category for me. So that does bring along its own kind of ethical issues around consent and getting potential parental consent. And I do understand that it's a real challenge, particularly for policymakers rather than researchers, because researchers have the time to invest in those kind of things because that's kind of their core business. Whereas the policymakers just have to work with what they have in a lot of ways. In terms of tokenism and things like that, again, there is this kind of balancing act and the Young and Resilient Research Centre has some really nice slides on that around, when does it always have to be co-design? Can it just be consultation? And is consultation such a bad thing? So there is a real balance, and that really comes down to what is the purpose of what you're doing. And I guess even further than that is there a genuine concern, or is this done in a genuine manner? And I think that's really at the crux of it, is which becomes an ethics issue. Is, are you doing this because you genuinely want to do it, or is it a tick box exercise? And I think people care. So it's more comes down to the resource constraints and the kind of areas that they're working in. In regards to the access study, I was not directly involved in that. I know that they were able to get some young people to be involved who were part of the broader study, and I think they engaged those people because they had particular skills or the ability to kind of sit in that space. And so there are, again, things around being able to support young people if they are going into these kind of settings where they are expected to engage with clinicians and policymakers and these things. There's a set of skills that are required there as well. I can't speak as towards the recruitment, but I think, again, there's a number of kind of things that need to be thought out, and it's going to be always on a case-by-case basis. I hope that answered some kind of question.
Great, thanks, Dan. Yes, really important to get young people and their voices heard, I think, despite the extra work and cost, just because it really pays off. So, Susan, I jumped over before. Monitoring requires setting targets, which can also be a future advocacy tool when targets aren't met. I'm assuming that there was little evidence of targets for any indicators within these policies. I think you mentioned that briefly, Dan, but if you could elaborate. And I also wanted to just add in a question there. I noted that a number of the policies had a focus on resilience and strengths and well-being rather than deficits. And I was wondering if there were any measurement indicators for resilient or for well-being and strengths, because that's sort of an area that I found challenging in research.
Yeah, thank you. I guess part of the issue around monitoring and evaluation for these policies are that they're so broad. They're looking at general health and well-being, so it becomes it's such a big area that sometimes these kind of things are difficult to set up. So those kind of things around targets, in terms of the people that I talked to and in terms of the publications that we reviewed, there's a lot of variance. So some of these policies do have their kind of monitoring framework published within the back of the kind of appendix, whereas some of they just didn't have anything that was really mentioned. Again, that doesn't mean it's not there. It just means it's not easily available to researchers to be able to see. But when we're talking to the policy development people, they do kind of tend to indicate that there is a difficulty around setting targets and not necessarily resources to be able to implement or to be able to set up these kinds of monitoring systems. And then again, in terms of positive outcomes for young people, a lot of it was around, I guess, this kind of sense of community and belonging and feeling that they have a sense of purpose in life, and then things like resilience as well. But I don't think there's any hard and fast measures that are used across the board or in some kind of uniform way. So it's difficult. It's easy to kind of point fingers and say, these are things that need to happen, but the actual thought and process of trying to get these things done is very difficult. So it's not an easy task.
No, thank you for those informed words. So we've got a question from Emma. So this is exciting. New South Wales Health are currently undertaking a review of the Youth Health Framework, so the New South Wales Youth Health Framework, and the Matilda Centre is facilitating a consultation forums on the 28th of June, including opportunity for in-person attendance based at located at Westmead, and regional virtual participation in various locations. So that's really just a call out, a shout out to people who are interested in this, especially this audience who would be quite knowledgeable and have a lot to contribute, to please to join. So maybe Emma, you could provide some sort of information to us, and Sharon will send that out to everybody on the call. And I just wanted to also say Maya has from AAAH that just a shout out again to this event. So developing youth. Oh, so this is the event. Sorry, great. There you go. It must be. Is it the event, or is that something different? Anyway, we'll transmit all of this information to you. That's a different one, AAAH. Okay. Can I ask another question? Because we do have just we do have some more minutes to go. Sorry, I just seem to have, there we go. You mentioned that in the policy, in the health system and policy funding space, that youth health kind of gets drowned out by other areas of health and policy development, and it's just a small area. And I know that from my experience working as a senior clinical advisor for the New South Wales Ministry of Health over years, I could observe that, you know, youth health is a small, tiny area of you know, the health system and New South Wales health system and its funding, etc. And that applies not just to youth health, but it also applies across child health as well, and paediatrics. We're quite a small area of health. So I'm not sure how we can. I know you mentioned a few strategies there. We could all come together and try to create that tension for change. You gave some very good advice on that. I'm not sure if you wanted to talk about this ongoing issue for us.
Yeah, I think it comes down to this kind of idea of relative priority in terms of what are the most important things that we need to focus on. And it, you know, it's understandable that there are other kind of issues happening that need attention. But I think if we're able to kind of change this narrative around the fact that adolescents are healthy and that you can wait for them to become unhealthy later on in life. And if you could kind of shift that narrative around the fact, like, look, early intervention is a lot cheaper than heading these issues off later on down the track, and the kind of changes that it can have on a young person's quality of life and the cost to the health system. If we can really kind of emphasize that message, I think that's important. But then again, the things like that requires that advocacy and building coalitions. And I think there's a real value in putting people working across health departments and across different states in this space. Could be quite a useful thing, because I think people are all struggling with the same challenges, and people have built and identified their own solutions. And sometimes I think there's a lot to be learned from others who are already working in the space. So yeah, I think again, it's very much just trying to win the hearts and minds. But if you look at even just the development of youth health policy over the years, there is clearly wins being had. We are kind of, you know, we are growing attention, and things like just even the fact that we are consulting with young people and including them in co-design projects through governments shows that, you know, we are actually on the right track, and hopefully we could just grow momentum and maintain that. Thank you.
That was excellent. Now, because sorry, I'm just, you know, take my chair's prerogative here and continue the conversation, Dan, if that's all right, because we don't have any other questions from the floor. But yeah, so I'm very interested to think about and to sort of work out, well, what would be the levers, do you think? I mean, you've mentioned quite a number of them, and to get the attention. I mean, I suppose it's an iterative process, as you said, building on what we've already got. But is there a way to influence, you know, the funding envelope or at the policy sort of level, political? Like, how can we, WH&Y, what could we do going forward to sort of to get more attention on youth health?
Oh God, I think the workshop that we're doing for AAAH will be a useful one for putting people in touch with each other and to try and build that kind of coalition. These things like the why, again, it's all about building coalition and then trying to determine advocacy approaches. I think there's probably people on here, Maya, I'm looking at you, who would be probably better versed in advocacy and things like that, which is probably what's needed a lot of. But I think if we can kind of use research to clearly identify the implementation issues and have those very clearly defined, it at least shows where the work needs to go. And so by having those kind of identified, we can kind of go to funders, or we can, work within ourselves to kind of say, well, these are the things that need to change to get to the next level. And I think that kind of approach is really useful, and I hope we can kind of continue to go through that.
Yeah, great. So James has squeezed in a question at the end. Do you have any suggestions for building more effective collaborations across youth policy portfolios, education, justice, digital safety?
Yeah, this is my biggest kind of, I guess, question around these kind of areas, because I'm working in an education space now as well, and it's just this how to we all know that there's these kind of social determinants of outcomes they don't sit within a department, they're across the board. And so how can you get these kind of departments to work on these issues? South Australia has a health in all policies approach, so it'd be interesting to look at how effective that has been, because they try to kind of identify health issues within their different portfolios. I don't know what that experience has been like, but it'd be interesting to talk to some of those people and see what their experience has been. And that may be the way that has to happen, is that you have to have some kind of cross-portfolio approaches. But again, I'm sure that there's policy people in here who've got much more knowledge and understanding of the processes required.
Thanks, Dan. So we might, that's really fabulous. You've just really, I think you're one of the absolute experts in evaluating policy and implementation of youth health policy. So it's really wonderful that we have you amongst us. So, and thank you so much for sharing your wisdom. So I just want to thank everybody for their attention too, and that please join us in a month's time for the next Wellbeing, Health and Youth webinar. We will send out information. It'll be another exciting topic, so I don't have it in front of me. But yeah, so thank you, and I hope you all have a fabulous afternoon. And thanks, Dan.
That's all.